Hey, what's up you guys? If you are new here, my name is Allie. Thank you so much for joining me. Today's video is one that I've been wanting to do for a really long time, and I'm finally getting the chance to do it now. So I am bringing you an FAQ about ACL/knee surgeries in general. If you've been following my story at all, you know that I have been through 4 knee surgeries and will be having a 5th one in the next 6 to 8 weeks. And so I have a bit of experience as far as knee surgeries go and what to expect. So I wanted to share that knowledge with you. Before I start this, I want to preface this entire thing by saying I am not a doctor. If you have specific questions about your case, your treatment, anything like that, please go to your surgeon, your physician, your physical therapist. All of those people will know far better than I what to do in a specific scenario. This is more of a video of broad general knowledge coming from my almost decade of experience going through these types of things, but I do not have the medical background to provide you specific information as far as treatment for your ailment. That being said, here are some of the questions that I've been asked like 100,000 times. These are things that I may not have known if I was a new patient for an ACL injury. I'm planning to make a video later down the line of what I wish I would have known before my ACL surgery. If you want to see that video, let me know down below if that's something that you're interested in. I'm happy to talk about those specific things. This is more just like things that I've been asked over the past 10 years. So what is an ACL injury for those of you who don't know? So it's the tearing of the ACL. It's the main ligament that goes through the knee. It connects the femur and the tibia, right in the center there. The other ligaments around the MCL, the medial collateral ligament, and then the LCL, the lateral collateral ligament, those are also ligaments, obviously, that are on other sides of the knee. The LCL is a bit more narrow and less broad than the MCL, and usually you only tear the LCL if you've simultaneously torn the other ligaments as well. The kneecap, all of those other ligaments help comprise the knee. The ACL is generally the one that people talk about. It's the most oftenly torn ligament of the knee. One question I've been asked a lot is, what are signs and symptoms of an ACL injury? How will I know if I've torn my ACL? Is there any telling signs? I had a friend of mine text me last week asking for advice as far as if he had torn his ACL, what he should do. Generally, if you hear a loud pop or a popping sensation in the knee, that's a pretty good indicator that something is wrong, potentially an ACL. If you have severe pain, or if you're really unable to walk, if it feels really unstable, if your knee kind of gives at all, that's a pretty good indicator of an ACL tear. If you have a loss of range of motion, so if you can't bend your knee, like pretend this is your knee and this is the rest of your leg, and if you can't bend like this, that's a pretty good indicator also of an ACL tear or just some other ligament issue in the knee. So now that we know that, factors that contribute to ACL tears. This isn't really a conclusive list. There's a lot of factors that are still being studied, but some factors include, number 1, gender. Women, like myself, unfortunately, are more likely to tear their ACL. Our anatomical structure, the way that our legs, we generally have wider hips than men, and that forces more pressure to be put on our quads than on our hamstrings. And when that uneven pressure is placed there, we have wider hips, and that can force an imbalance between the quads and the hamstrings. When we have the imbalance between the two and the hamstring is not being used to its full function, the hamstrings help the shin bone from moving too far forward, and that movement, the moving of too far forward, can overextend the ACL, and that overextension can contribute to an ACL tear. Another factor is genetics, just the trait being passed down. If your family has a history of bad knees, it's more likely that you will probably have bad knees. Families who have poor structure in the knees, they're at a higher risk. My grandma has had knee replacement. My mom has had a meniscus surgery. My sister has had an ACL surgery, and I've had 4 ACL surgeries. So it's kind of a family gig that we got going on. Not the best, but it's definitely a factor. And then the third factor I want to talk about is just the activities that you participate in. So soccer, lacrosse, basketball, football, any stop and go motion. Tennis can even be one. Any of that stop and go is really gonna put that pressure on the knee, and it could force it to move in an unnatural way, causing the ACL to tear. So those are some of the factors. Just because you play soccer, lacrosse, any of those sports does not mean you will tear an ACL. Girls who play soccer often tear their ACLs. I was a soccer player and I did it, but I know many soccer players, many of my friends and teammates went their entire soccer career without tearing their ACL, without injury. So just because you're involved in one of those things does not mean you will tear your ACL. It's just, you just want to be conscious of that fact. Question I get a lot: whenever someone sees me on crutches, they ask, oh my gosh, what did you do? How did you do it? What's going on? And then I have to tell them the full story of how I tore everything, and basically the last 10 years of my life, because it doesn't always make sense unless you have all the pieces to fit together. So I think I'm gonna make a story time video about my injuries, my first 3 injuries and how they happened. It's too long to put in this video, so I think I'm going to be doing that, but this most recent time was pretty lame. I was working out and I jumped up onto a platform and I landed wrong and I fell over. That's pretty much it. Like, I just jumped and landed wrong because I was dumb and I have unstable knees and I should have known better and I didn't. So that's pretty much it. Not a super great story, but that's that. Now, for those of you who are about to have surgery and have questions about, oh, what's this gonna look like for me? How long does the surgery take? How long am I gonna be in the hospital? That kind of thing. The good news is that ACL surgery is an outpatient surgery. So you go in and you leave during the same day. I try and always have my surgeries done in the morning, because I wake up early, I go to surgery. Surgery takes anywhere from 1 to, honestly, I don't really know. I'm always the one having surgery. I think it takes anywhere from 1 to 3 hours. Don't quote me on that, but it takes a few hours. I wake up, I go home, and I just chill, and I'm on medication the rest of the day. So I basically just get it done all in one day. Surgery day kind of goes something like this. So you show up, you arrive, you check in. After you check in, they'll bring you back to pre-op. You'll get in the gown, and they'll give you fun socks, and they'll ask you about like a million times which knee that they're operating on. They'll often draw a big giant X on your knee to make sure that they're operating on the right one. Well, I guess the correct one. They'll get an IV, usually put it right here in your arm to start getting the meds flowing. Sometimes the meds will kick in and you'll be completely unconscious before they even wheel you off to surgery. 2 out of the 4 times I have made it where they have put me on the operating table and then I'm immediately out. So it really just depends, but you will not feel a single thing the entire surgery, and then you'll wake up and it'll be really groggy and your throat's gonna be really dry and you're gonna want a ton of water. But honestly, surgery day is one of the easier days of this whole process because you just get to lay there and be unconscious the whole time. I've been asked this in the comments quite a bit, or in my Instagram DMs. If you want to find me on Instagram, it's the Allie B. I'll have it all down in the description. But I've been asked, people who are having surgery soon, they ask me, is it painful? Does it hurt really bad? Like, is there anything I can do to ease the pain? And to be honest, the first day isn't really bad. You'll wake up and you'll kind of just be in a haze for most of the day, that first day. I'm gonna be straight with you. I would want honesty if it were me too. The first week is pretty rough. Just existing is pretty exhausting. That's why they give you the pain medication to help make existing not as difficult. Yeah, the first, honestly, days 2 through 4 were and have continued to be the hardest days for me, and then after day 4 it usually gets better and better. My recommendation, I know it hurts, but for people who are going to have the surgery, just do the exercises your doctor tells you. I know it sucks, I know it hurts, but you will be so much better off if you just do what the doctor tells you to do and fight through the pain. You will be stronger because of it, and it will make you better. You will be better faster. I promise you, it will help. It sucks, but I truly believe that nothing good can really come with just trying to skate by. You got to put in the hard work and you will see the results that you want. As far as trying to ease the pain, honestly, my escape was sleep. I just tried to sleep as much as possible because I didn't want to deal with the reality that I was living in. It's maybe not the best approach. Having a support team, like just your friends and family support you and be around you and try and take your mind off of it. I know the first few surgeries, I had friends and family coming over and they would hang out with me and they would just like sit and watch Netflix with me. And spend time with me because I didn't have to think about anything. I could just be. I didn't have to think about the pain I was in because I could spend time with the people that I love. So make sure that you don't shut those people out because it's so easy to do because they don't understand what you're going through. Try not to shut them out. Try to let them in and let them help you. That is something that I am continually learning every time I do this. So many people ask me when they see me on crutches, they're like, how long will you be on crutches? You know, that kind of thing. The entire recovery process takes about 9 to 12 months. Now, that does not mean you are on crutches for 9 to 12 months. 9 to 12 months is like you're back to 100. You're A-okay. You can go back to doing your normal life activities. The first 3 weeks is about regaining strength and weaning yourself off the pain meds. You probably won't be off crutches at this point. Usually you're on crutches for anyway 3 to 6 weeks depending. So depending on the extent of the injury, you could be off crutches, you could still be on them. It really just depends. From that 3-week point, it's really dependent on the extent of your injury and what your surgeon and your PT have prescribed for you. But like I said, total recovery back to full strength, back to 100 can be anywhere from 6 months to a year. You really got to put in the work. It sucks, but it'll be worth it in the end to see how far you've come. And that's why I'm making these vlogs, because I see where I was in May, just sobbing and hating my life and being so depressed and in a really dark place. And I can look back now and see, wow, I can squat again. I shouldn't be, but I can run again. I can do all of these things that I couldn't do 6 months ago or however long it's been. So you got to think of future you and what you're working towards. One of the things of many that is unfortunate about ACL surgery is that, you know, it's your leg that you have to deal with and you have to try and bathe yourself. People ask, when can I shower? How long is it until I can shower? Because you aren't supposed to shower for a certain number of days. Number one, this is when dry shampoo becomes your best friend. Thank you, Jesus, for dry shampoo. But you can't usually get your stitches wet until 7 to 14 days post-op. And so what do? What I have done is my husband and I saran wrapped my leg so I could take a shower. I have washed my hair in the sink and used like a washcloth to try and, you know, clean my body while I wasn't able to be in a shower. I've had to like stick my leg out of the bath and just like clean the rest of my body because you really just can't. So I've been DIYing how to do this best. I haven't found a great solution, unfortunately, but saran wrap that puppy and you'll be okay. Also, along that same line, like when you can finally immerse your leg is usually around 4 weeks. That's pretty dependent on what your doctor says and how far, like what the extent of your surgery is and if your wounds have closed up. But usually 4 weeks, you're okay with going back into swimming pools and in a bathtub and completely immersing the injured leg. When can I drive? Oh my word, this was always my question because I tore my ACL for the first time when I was 16 and I had just gotten my license and I was ready to go on the road and I was so excited to drive, and then I tore my ACL with my right leg, which is your driving leg. So that was really unfortunate. So some people like being chauffeured around, but I love to drive. So that was one thing that I was like, when can I drive? Like I said, for a lot of these answers, it's really dependent on the extent of your injury, but it's generally 3 to 6 weeks after. Always ask your doctor. You also need to make sure that you're not on any narcotics anymore. Make sure you always check with your doctor, and you need to make sure that you can fully press on the brake, like fully press. If you tore your ACL on your left leg, you're in a better spot, I guess, because your driving leg is still okay, so you'll have a less time. You just need to be able to put your left leg into the car. But with your right leg, if you've injured your right leg, you need to be able to have the same reaction time as you would with the other leg. So definitely check with your doctor and make sure that's okay. I understand, like, I know you want to drive, but for the safety of other drivers on the road, you need to make sure that it's a thing that you are being aware of. This video is forever long and I'm so sorry. Just a couple more questions. One is that one I've gotten from you. One of you told me that it's been a little while after your surgery and your leg is still pretty swollen, and this is totally normal. It can take anywhere from 4 to 6 weeks for all the swelling to go down, and if it hasn't gone down by then, your physician can drain the extra fluid in your knee out. So don't be concerned. To try and get rid of that fluid, you just need to make sure that your leg is elevated. A good frame of reference is to make sure that it's above your heart. So if you're laying down, you want your leg to be above your heart like that. Is there an optimal time of year to have surgery? That super depends. I've had surgery in May, I've had surgery in July, October, what's the other one? March. I've had surgery all different times of year. It really depends on A, the climate in which you live, and B, what your preference is. So for me, I didn't mind having my surgery done in the winter. Yes, it snows where I'm from, but I was okay with that because I was sitting inside most of the winter anyway, because it's so cold, as opposed to the summer where I want to be out with all of my friends and at the beach and running around in the nice weather. It's harder for me because I can look outside and I can see all of my friends and family having a good time, like going out on the lake and everything, and I just have to sit beside and watch. So it really just depends on your preference. I always wanted to get my surgeries done as soon as possible, so as soon as I had the injury and then found out from the doctor that I needed surgery, I just wanted to get it done as soon as I could. Now, that may not be what you want to do. Maybe you want to wait through the summer and your doctor is okay with it. That's fine. You do you. Like, if your doctor is okay with it, then by all means do that. But if your doctor is insistent that you have surgery sooner rather than putting it off for a little bit, you should really go with the doctor's recommendation. They know what's going to be best for you. But I've just always been of the mindset that I wanted to get it done and move on with my life and be better as soon as possible. So that was always what I wanted to do. It's really a personal preference. So the surgery I will be having is to A, give me an ACL, B, repair the 70% of my meniscus that isn't there, and B, do an ACI repair. So what is ACI? I'm going to read this off my phone because I don't know all of these big words. ACI stands for autologous chondrocyte implantation. It's a biomedical treatment that repairs damages in articular cartilage. The goal of ACI surgery is to allow people suffering from articular cartilage damage to return to their old lifestyle, regaining mobility, going back to work, and practicing sports again. So basically, all the cartilage, my knee is just so messed up, guys. Oh my word. I have messed up cartilage, no ACL, no meniscus. There's a bacteria in there. If you didn't hear about that, I'll put a thing up there or down in the below so you can go check it out. But I got so much going on. So they're gonna repair the cartilage in there. It's going to take 2 years to be fully recovered, which I'll be 80% recovered by the end of the first year. So by November, December 2019, which, wow, that's gross to think about. But by that time, I will be 80% healed, and then the last 20% comes in the year 2020, which, oh my word, it's like, I cannot believe it's 2020. I've never dealt with anything like this before. It'll be a learning experience for me, and I hope that I can share that all with you, any of you who are following along on this journey with me. I don't really know 100% what to expect. I know it will be similar to what I've experienced with the previous 4 surgeries, but I'm a bit nervous. I know this is a lot more extensive than before. So if you guys just want to be thinking of me, that would be super cool. Another question, a lot of people ask me, what do I do sports-wise? Like, how do I work out? What can I do? And for a person in a similar situation, what types of things should I be doing to work out or staying active? For a lot of people, as soon as you recover from your ACL injury in your back after that 6 to 12 months of rehab, you can go back to doing the sport you love. I did that. I was totally fine for 18 months after my first surgery, and then I tore my ACL again. So a lot of people can go back. I mean, NFL players do it all the time. Pro athletes do this all the time. I mean, they have a lot more money and skills and, their career on the line, unlike the rest of us. But, you can go back to doing the sport you love. It doesn't mean that your ACL injury is a career-ending injury. You can go back. You just have to know that there's going to be risks with going back. The likelihood of re-tear after you tear your ACL the first time is significantly higher. But if that's a chance you want to take, then I say go for it. I did the same thing, and I went back and I pursued my soccer career, and, it didn't end the best for me, but I mean, in a way it did, because I would not be here doing what I'm doing right now if not for making that choice. So I believe that every choice you make will lead you to where you're supposed to be. since this is the 4th/5th time I'm going through knee surgery, I'm very picky and choosy about the activities I partake in. I love to hike, I love to swim, I love kayaking, I love just going to the gym and lifting weights. You know, I do some cardio. I do love to run. I shouldn't be running right now. I haven't really been running, but I do love to run. I just don't do contact sports anymore. I can't do it. I can't afford to keep having knee surgery, and B, I don't want to put myself through the pain anymore. I still love and have a passion for soccer, and whenever I see people playing it, I want to play too, but I know that that's part of my life that's in my past, and while I loved it and, you know, thrived in that for, you know, like 20 years or however long I played, I'm in a new phase of my life where that's just not a part of it anymore. And while that's hard and, you know, it breaks my heart to give it up, I know that I can still find fulfillment in other things beyond soccer. So if you're feeling like, you know, maybe you need to move on too, just know that you're not alone, and that feeling sad about leaving that part of your life behind it is sad, you know, I understand. But there's also a point where you have to decide for yourself what will be better for you. You don't want to put yourself through physical pain time and time again. And I've done it. I literally have lived it, and I can tell you that I made the right choices for me at the time. There's a point where you just have to say that it's enough. It's not an easy decision. I've cried time and time again because I've left that behind. But I know that I'm right where I'm supposed to be, doing exactly what I'm supposed to be doing, and that's all I can say about it. I'm now in the process of learning new things that I love and exploring new avenues and trying to love and enjoy them just as much as I loved and enjoy, and I still love, soccer, just in a different way. So that's it. I know this video was a super long one. I hope I answered questions that some of you may have. If there was something I didn't answer, or if there was a question that, you know, is really pressing, leave it down below. I could make a part 2 if there's something I didn't cover. Like I said earlier in the video, I am not a doctor. I'm not a PT. I'm none of those things. This is just coming from a person who's lived it. If you need, please seek out advice, medical advice from the professionals if you have a question about your specific case. If you want to keep following me on all of my adventures, you can find me on Twitter and Instagram. I'm the Allie B with 3 E's. If you want to keep following my journey on here, hit the subscribe button. I'm trying to get better at this consistency. If you want to follow more of my daily life, I spend most of my time on Instagram and Twitter. So thank you guys so much for hanging out with me. I know I covered a lot of topics, but yeah, thank you guys so much for watching. Please subscribe if you haven't already, and I will see you guys next time. Bye.